PSC നേഴ്സിൻ്റെ പുതിയ വീഡിയോയിലേക്ക് സ്വാഗതം. കേരള DHS സ്റ്റാഫ് നഴ്സ് ഗ്രേഡ് 2 എക്സാം പ്രിപ്പറേഷനാണ് ഈ ചാനലിൽ നടന്നുകൊണ്ടിരിക്കുന്നത്. മെഡിക്കൽ സർജിക്കൽ നേഴ്സിംഗ് ക്വസ്റ്റ്യൻസിൻ്റെ 350 വരെ മുതൽ 400 വരെയുള്ള ചോദ്യങ്ങൾ ഈ പാർട്ട് 9 വീഡിയോയിൽ ഡിസ്കസ് ചെയ്യുന്നു. മറക്കാതെ പഠിച്ചിരിക്കേണ്ട ചോദ്യങ്ങൾ ഇതിലുണ്ട്. വീഡിയോ കാണുന്നവർ ശ്രദ്ധിച്ച് പഠിക്കുകയും അത് മനസ്സിലാക്കുകയും ചെയ്യുക. പഠിക്കുന്ന എല്ലാവർക്കും വിജയാശംസകൾ നേരുന്നു. ജഗദീശ്വരൻ എല്ലാവരെയും സഹായിക്കട്ടെ. നമുക്ക് ഇന്നത്തെ വീഡിയോയിലേക്ക് കടക്കാം. A client has undergone with a penile implant after 24 hours of surgery. The client's scrotum was edematous and painful. The nurse should. A client has undergone with a penile implant after 24 hours of surgery. The client's scrotum was edematous and painful. The nurse should. Elevate the scrotum using a soft support. Elevate the scrotum using a soft support. Principal hormone high in Cushing syndrome is dash. Principal hormone high in Cushing syndrome is dash. Glucocorticoids. Glucocorticoids. At which temperature packed RBC are stored? 4 degrees Celsius. Bladder musculature helps to expand during urine filling. Bladder musculature helps to expand during urine filling. Distressor. Distressor muscle. Tymphanoschlerosis is also known as Meningiosclerosis. Meningiosclerosis. Most serious complication of fracture of bone is dash. Most serious complication of fracture of bone is dash. Fat embolism. Fat embolism. In case of a patient with the diagnosis of chronic kidney failure, the signs of which electrolyte imbalance should be monitored. In case of a patient with the diagnosis of chronic kidney failure, the signs of which electrolyte imbalance should be monitored. Hypocalcemia. Hypocalcemia. The enzyme study that is most specific to myocardial infarction is dash. The enzyme study that is most specific to myocardial infarction is dash. CPKMB. CPKMB. Food item need to be avoided in a client with hepatic dysfunction to prevent hepatic coma is. Food item to be avoided in a client with hepatic dysfunction to prevent hepatic coma is dash. Protein. Protein. Clinical manifestation expected in a client with SIADH is. Clinical manifestation expected in a client with SIADH is low urine and hyponatremia. Low urine and hyponatremia. One word for bleeding into the joint is dash. One word for bleeding into the joint is dash. Hemoarthrosis. Hemoarthrosis. Collection of blood in the tunica vaginalis layer of testis is known as collection of blood in the tunica vaginalis layer of testis is known as hematocele. Hematocele. Glomerulonephritis is a inflammation of glomerulus of nephron. Glomerulus of nephron. Normal serum urea level. Normal serum urea level 15 to 40 mg per dl. 15 to 40 mg per dl. Which investigation to be done after thyroidectomy? Which investigation to be done after thyroidectomy? Serum calcium level. Serum calcium level. Cytokines are secreted by neutrophils. Neutrophils. Drug used to constrict the pupil is dash. Myotics. Myotics. Trendelenburg test is used to detect varicose vein. Varicose vein. Tracheostomy site is dash. Tracheostomy site is dash. Between second and third tracheal ring. Between second and third tracheal ring. The common factor of puerperal sepsis, scarlet fever, otitis media, bacterial endocarditis, rheumatic fever and glomerulonephritis is that all dash. Common factor of puerperal sepsis, scarlet fever, otitis media, bacterial endocarditis, rheumatic fever and glomerulonephritis is that all dash. A result from streptococcal infections that enter via the upper respiratory tract. Result from streptococcal infections that enter via the upper respiratory tract. A stethoscope placed at the tip of the sternum will best be able to detect. A stethoscope placed at the tip of the sternum will be best be able to detect bicuspid valve. Bicuspid valve. Pruritus means dash. Pruritus means dash. Itching. Itching. Accidental removal of parathyroid gland during thyroidectomy result in accidental removal of parathyroid gland during thyroidectomy result in dash. Tetany. Tetany. The term anorexia means dash. The term anorexia means dash. Loss of appetite. Loss of appetite. One patient is posted for minor surgery. Which instruction can be given for patient? One patient is posted for minor surgery. Which instruction can be given for patient? NPO for 3 hours. NPO for 3 hours. Visual loss in the same half of the visual field of each eye seen in stroke patients known as visual loss of same half of the visual field of each eye seen in stroke patients is known as Homonymous hemianopsia. Homonymous hemianopsia. Drug of choice in anaphylactic shock is dash. Drug of choice in anaphylactic shock is dash. Adrenaline. Adrenaline. Endocarditis is most commonly seen in mitral regurgitation. Mitral regurgitation. Digitalis given to the atrial flutter produces. Digitalis given to atrial flutter produces atrial fibrillation. Atrial fibrillation. In India, acute hepatitis A mostly affects. In India, acute hepatitis A mostly affects children between 3 to 12 years. Children between 3 to 12 years. In hemolytic anemia which is decreased. In hemolytic anemia which is decreased. Haptoglobin and hemopexin. Haptoglobin and hemopexin. Chest configuration in a patient with emphysema is dash. Chest configuration in a patient with emphysema is dash. Barrel chest. Barrel chest. Barrel chest. Which therapeutic classes of drug is used to treat tachycardia and angina in a client with pheochromocytoma? Which therapeutic classes of drug is used to treat tachycardia and angina in a client with pheochromocytoma? Beta blockers. Beta blockers. Emergency treatment for client with tetany. Emergency treatment for client with tetany. Calcium gluconate. Calcium gluconate. The branch of science that deals with the diagnosis, treatment and study of cancer is called as dash. Oncology. Why pressurized bag is used in arterial line monitoring? To prevent the backflow of blood in the tubing. To prevent the backflow of blood in the tubing. Drug of choice for supraventricular tachycardia is dash. The drug of choice for supraventricular tachycardia is dash. Adenosine. Adenosine. Surgical removal of pituitary gland is known as dash. Surgical removal of pituitary gland is known as dash. Hypophysectomy. Hypophysectomy. Rapid infusion of insulin causes. Rapid infusion of insulin causes. Hypokalemia. Hypokalemia. A patient with a myocardial infarction is receiving myovin or IVGTN, which the nurse should assess frequently. A patient with a myocardial infarction is receiving myovin or IVGTN, which the nurse should assess frequently. Blood pressure. Blood pressure. In shock, primarily there is dash. In shock, primarily there is dash. Poor perfusion of tissues. Poor perfusion of tissues. Mumps virus or myxovirus attacks which glands? Mumps virus or myxovirus attacks which glands? Parotid. Parotid glands. Position used while inserting NG tube or nasogastric tube is dash. Position used while inserting NG tube is dash. High Fowler's position. High Fowler's position. Earliest sign of glaucoma expected. Intraocular pressure is dash. Earliest sign of glaucoma expected. Intraocular pressure is dash. Diminished accommodation. Diminished accommodation. What is a late sign of cervical cancer? What is a late sign of cervical cancer? Hematuria. Hematuria. The closure of the aortic valve in the arterial waveform is denoted by. The closure of the aortic valve in the arterial waveform is denoted by diastolic notch. Diastolic notch. What is the earliest sign of acute respiratory distress syndrome? What is the earliest sign of acute respiratory distress syndrome? Increased respiratory rate. Increased respiratory rate. Mycobacterium tuberculosis is aerobic acid fast bacillus. Aerobic acid fast bacillus. Collection of pus within the lung tissue is known as. Collection of pus within the lung tissue is known as lung abscess. Lung abscess. Drug of choice in anaphylactic shock is dash. drug of choice in anaphylactic shock is dash. Adrenaline.
താങ്ക്സ് ഫോർ വാച്ചിങ്. PSC നേഴ്സിൻ്റെ വീഡിയോകൾ ഇഷ്ടപ്പെടുന്നവർ ഈ ചാനൽ ലൈക്ക് ചെയ്യുകയും നിങ്ങളുടെ അഭിപ്രായങ്ങളും നിർദ്ദേശങ്ങളും കമൻറ്റ് ബോക്സിൽ രേഖപ്പെടുത്തുകയും ചെയ്യുക. വീഡിയോ കാണുന്നവർ ഈ ചാനൽ സബ്സ്ക്രൈബ് ചെയ്യുകയും ഫ്രണ്ട്സിന് ഷെയർ ചെയ്യുകയും ചെയ്യുക. ധാരാളം വീഡിയോസ് PSC നേഴ്സ് എന്ന ഈ ചാനൽ ഉൾപ്പെടുത്തിയിരിക്കുന്നു. വീഡിയോസ് റിപ്പീറ്റ് ചെയ്ത് കാണാൻ ശ്രമിക്കുക. അത് നിങ്ങളുടെ ഓർമ്മയെ കൂടുതൽ ശക്തിപ്പെടുത്തും. നന്നായി പഠിക്കുന്ന എല്ലാവർക്കും ഞങ്ങൾ വിജയാശംസകൾ നേരുന്നു. നന്ദി, നമസ്കാരം.